A very good evening to the respected chair and to the delegates. Before I proceed into my discussion, I would like to apologize to the chair and to the delegates because if my voice is not clear, since I am having a little throat trouble. So my subject today is individualized management of female infertility with endometriosis using minimum dose of homeopathic medicine. A case series reporting based on the case records. I am Dr. Sreevidya, working as CMO, and I am the state coordinator of the Janani Homeopathic Fertility Center under the Department of Homeopathy, Kerala State. So, I should say, while often, besides the criticism from the external world, I myself, and I know many other homeopaths, do doubt whether homeopathic medicines can play a role in conditions where structural changes are produced. And also, often we have doubt whether our high potency homeopathic medicines can produce any effect, and is there any role for minimum dose. And though this case series reporting, it consists of 6 cases of the cases which had been consulted in our Janani unit, I do not proclaim that this is to prove the effectiveness of homeopathic management, but I am sure this case series and similar case series which is going to be produced in the Janani unit will become an answer to many research questions in future. And so this, you know, endometriosis is a chronic and recurrent disease condition characterized by the presence and proliferation of the endometrial glands outside the uterine cavity. We know this is responsible for a varied and disabling symptoms. We know the intense pain condition, the dysmenorrhea, the dyspareunia, and also the adverse effect this pathology produces on fertility of women. This endometriosis is such a serious condition that it hinders ovulation. It may prevent the fertilization when an egg or a sperm come together. It may block the tube, or it may produce severe adhesions, producing the stiffening of the reproductive organ that it remains helpless in a reproductive woman. And this produces a great mental agony to one who is seeking for a child. However, it is seen that the prevalence is 10 to 20% in women of the reproductive age group, and now it is said that 30 to 70% cases of infertility that comes for investigation are diagnosed to have endometriosis. And the sad part is, before, as we have learned, that this disease was more common in the age group between 30 after 30. But now it is said that this condition is found between the age group 20 and 30. And that is the most desperate condition too, because a young lady, when she gets married in her 20s, and when after not conceiving, when she approaches a gynecologist, this diagnosis of endometriosis produces a great depression, because the outcome for a good result is comparatively low when you compare with other ovulatory disorders and other conditions of infertility. And so in our Janani Homeopathic Fertility Centers, we see such many cases are now approaching in the recent 2 years back. Before we had more cases with PCOD, etc. Maybe as the evidence has increased in our OP, now more confidence has been aroused in the public that they have even cases requiring surgical manipulations are now coming to our OP. But as far as endometriosis is concerned, most of the ladies who come to our OP have already undergone the laparoscopic procedures. So this case series, I will be rushing through the case. And here, it was a young lady of 24 years, her husband working in the naval and she has done all her investigation from the INHS at Janani, New Delhi. And she was diagnosed to have severe endometriosis. She was done laparoscopy and she was found to have a very decreased AMH, and they said that it is not possible even to have an IVF. She must take a donor ovum. And she was referred to the OP by my friend, and the totality of symptoms, the logical totality of symptoms has succeeded in this case. And that too, the success was produced within a quite short duration of 6 months. And the wonderful symptoms which led me to the prescription were that, but it took 3 visits for me to reach those symptoms. But I would just say the symptoms so that I will get an answer from you. That one, she had a recurrent history of recurrent sore throat. She had an alternate stoppage of nostrils, and she was mentally very frightful, fear of darkness, fear of snakes, and as objective symptoms, she was found to have warts at the tip of her fingers. Beginning, I just observed the warts in her fingers and I have gave her Tuja, but later, when the symptoms became more definite, I am sure that you will be able to tell the medicine. The medicine was given was lacanum, and the good thing of this is that not only she conceived, her warts have disappeared, and also when she came to the OP, she had bleeding through the scar where laparoscopy was done. She was keeping a cotton pad on the umbilicus since the showing that the endometriosis was progressing in her even after the laparoscopy. But the good thing, after the medicine was given, the bleeding stopped, all her other objective signs which we found had disappeared, and happily she conceived, she delivered a baby girl. And this was a lady of 43-year-old gazetted officer, and she came with adenomyosis. We know adenomyosis is a condition of endometriosis that affects the intramuscular layer of the uterus. And this endometriosis, it produces a condition where it prevents the uterus from enlarging. And this lady, she did not have a problem with conceiving, but she had a problem in maintaining a pregnancy, because we know adenomyosis, which prevents the enlargement of the uterus, causes abortion. And this lady, she was given agnesia, and later, and she conceived, and throughout the period she was followed with her homeopathic medicine, and she was done. Even during that with the gynecologist, she strictly advised that amniocentesis should be done, and she continued with it, but finally we succeeded. She had delivered successfully. And similarly, 10 years cases of infertility, which had done IUI 8 times, advised for IVF. She had conceived after taking treatment from OP for 1 year. But by the beginning after 2 months, she conceived, but she aborted. We continued the treatment. It's a case of severe diagnosed to be severe endometriosis, and she conceived after 8 months of treatment, and she had also delivered. So a case analysis, this is a discussion, and here you see I have made a table of the lady, 20 years, severe endometriosis. She commenced her treatment from 28/5/2015, 3 visits. Tuberculum was given, phosphorus, then tuberculum, then 1 more phosphorus 10 and she conceived. And severe endometriosis, calcareous 10 and the third case, 10 years of infertility, she was given, I'm not sorry, it's not Tuja, it was tuberculum, then nitric acid, cocculus. And the cases of adenomyosis, ignetia tendum, as I said, and the bilateral endometriosis, which she had undergone surgery. I had conceived, though I have gave Sepia, I knew it was a wrong prescription, but later the prescription Staphylococcus aureus tendum produced her a good result. So after the OP, from all these cases, we see that I am not able to reach a specific for endometriosis. Only with individualizing medicine, surely, which proves materia medica, the significance of the materia medica. And here also I have given very high potency, and only 1 single dose has been given, and which had produced the result. And so I am very confident that when if our OP, we may more such, I hope that cases approach our OP without doing any laparoscopic procedures so that we can prove that our medicines are able to cure even such cases without undergoing laparoscopic procedures. Such case records are now being collected, but as further procedure, the department has decided to take the endometriosis cases study into detail. We are going in the way of preparation of the protocol, and detailed case records have been prepared, and we are preparing for a presentation of a research paper by next year, hoping we will be able to produce a good research paper on endometriosis with proof of action with single homeopathic potency in minimum dose. I hope in the same stage like this, a paper could be presented in the next future. Thank you very much.